let's talk about some pinhole cases. I was very fortunate. I love doing the pinhole technique, and I was the first clinician in the United States to be certified as an advanced pinhole practitioner. And here are some cases, some before and after cases. The maxillary arch, before and after. I love these cases. They're challenging, they're interesting, they're very technique sensitive. The challenge is fascinating, and I love doing them. So again, here's the before and after. And the lower anterior is always the most difficult area because that muscular tissue, that muscle is pulling the tissue down, gravity is pulling the tissue down, makes it very difficult. But we love treating them, and we're almost always able to improve that situation. This is another maxillary situation. Again, on the left is the before and the after. This was quite severe. You can see the recession before, after, and after. Look at the lower cuspids, dramatically better. Again, this patient was just in recently, and she really was concerned about the lower cuspid, especially the lower right cuspid. So this was within the last couple of months. We did the treatment, and you can see the before and after, and of course, those cuspids are looking great, and I think we're going to be able to stop that recession because the goal of treatment is not just to cover the roots, which we try to do, but the goal of treatment is to stop the recession because when the gum recedes, the bone recedes too. And if you lose the bone, you lose the tooth. So we want to get thick tissue. We want to get thick, healthy tissue to prevent further recession and therefore further bone loss. And here's another case, before, lower anteriors, and after, before. This is the upper, look at those upper incisors, especially the left incisors, before, after, before, lower anteriors, lower right area. Again, the results are great. As I said, I love doing these cases. It's not that they're easy, but they're gratifying, very gratifying. Before and after, upper right area, before, after. This was interesting. These teeth were stained. Those brown stains are actually stains on the root, and we were able to cover those roots and stop the recession. Another interesting case, this lady had a habit of sucking on lemons, and the sucking on lemons dissolves the tooth structure and makes them prone to stain. And we removed all of the stain, removed those restorations, and covered it. And this is the before and the after. Before, after, recession throughout the whole mouth. And basically, we stopped that recession, and this patient was extremely happy, not only because the teeth were sensitive, not only because the teeth didn't look good cosmetically, but the teeth were getting loose, and the patient wanted to save those teeth. Again, before and after, lower anteriors. This was an interesting case. This patient had 3 connective tissue grafts. I'm talking 3 in the past, and all of them failed. She came to me, and we were able to build that tissue up. It's still healing. There's still some bubbles there, but we were able to build that tissue up and stop that recession after 3 failed connective tissue grafts from the palate. Now, supposedly connective tissue grafts maybe are the gold standard. I've seen many patients who have failed connective tissue grafts. Not only do they fail, but the procedure itself can be torturous, can be extremely painful to the patient. Not the area of recession, but when they take the tissue from the palate, that can be extraordinarily painful.
It was a very smooth procedure, actually. I was anticipating that there was going to be a lot of pain, and it was surprising because Dr. Nemeth has prescribed me a prescription of Tylenol with codeine. I didn't even have to take it. So it was no pain at all. I have a whole new gum line now. You can even tell that the gum line had receded, and it just looks phenomenal. I mean, I can smile again.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.